Bembe, and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, the cancer burden is rising globally, exerting significant strain on populations and healthcare systems. In Kenya, cancer is the third leading cause of mortality after infectious and cardiovascular diseases. So today on Health Diary, we want to focus on one of the types of cancers that is least talked about, and that is leukemia. So what exactly is it about leukemia? Is it curable or not? Well, we'll find out after this fact of the matter.
Leukemia is a broad term for cancers of the blood cells. The type of leukemia depends on the type of blood cell that becomes cancer and whether it grows quickly or slowly. Leukemia occurs most often in adults older than 55 years of age, but it is also the most common cancer in children younger than 15 years.
Well, let's get to understand more about leukemia. And of course, to help us drive the conversation, I am joined by Dr. Daniel Butorire, who is a medical officer, clinical oncology department at the Texas Cancer Center. How are you doing today, Dr.?
I'm good, Winnie.
Thank you so much for making time for us. And of course, we're not alone. We also have John Otanga, who again is living with leukemia. And John, we say thank you, first of all, for coming by today to share your journey with us. How are you feeling today?
I'm doing well. I'm
You're
feeling
well.
good. Yeah,
all right.
thank you.
And Dr. let's just get to understand leukemia, because we rarely talk about it. And yet, again, this is a type of cancer that affects so many people out there. So when we say leukemia, what exactly are we talking about?
In simple terms, actually the word leukemia comes from a Latin word leukos, which means white, and aemia, which means blood. So leukemia, in short, it is a type of blood cancer that affects the white blood cells.
And how exactly does it affect then the white blood cells? But first of all, let's just get to understand how important white blood cells are for us.
So we look at the production of the cells in the body. They are what we call the progenitor cells, the stem cells that are actually the parent cells for all types of blood cells that we get in the body. And they are manufacturing centers. Number one manufacturing unit of the cells in the body is the bone marrow. And then this is followed by what we call the lymphatic system, the lymph nodes. And then there is another component which we call the spleen. In medicine, we call them reticuloendothelial system. This is the system that helps to manufacture cells that we have in the blood. So when you talk of leukemia, then we are talking of cancer that affects the blood and these blood producing systems in the body. So there are two different types of these types of cells, the stem cells. We have what we call the myeloid progenitor stem cells. These myeloid progenitor stem cells produce what we call the B lymphocytes and the T lymphocytes that help in immunity of an individual. Then we have also the lymphoid progenitor cells that now is responsible for production of white blood cells. There is what also red blood cells and platelets. So the white blood cells, in essence, they help in what we call immunity. They are the backbone of our immune system. They fight infections. They try and fight even development of other cancers in the body. And then we get the red blood cells. The red blood cells carry oxygenated blood from the heart to other parts of the body. When you're looking at the platelets now, the platelets are very important because they prevent us from unnecessary bleeding. When you are bruised or you are cut by something, the white blood cells aggregate and form what we call a clot that prevents the bleeding. So that's how important this lineage of cells are.
Very quickly, what causes leukemia before we talk about John's journey?
We know how it comes about, but the exact cause, it has not been delineated. So we can talk of risk factors. And when we're broadly discussing about the etiology of blood cancers, we usually divide them into what we call environmental factors. Environmental factors are things to do with diet, things to do with exposure, like to chemicals. Also ionizing radiation. Ionizing radiation, things like UV light, and especially the treatment that you use to treat some types of cancer, radiotherapy, it can predispose someone to getting cancer. But genetic predisposition has also been linked to development of these cancers.
And so, Otanga, for you, your journey goes back 10 years ago. And of course, you were just going about your business. You're okay, you're healthy, but then again, you started feeling a bit ill, right? Can we go back to how were you before you got your diagnosis that you have leukemia?
Yeah, it's been a journey since around 2011, around 11 years back. Yeah, I was just okay, going on with my errands everywhere. Now, it just started by, I noticed losing weight and getting tired. I was weighing around 100 and something, around 115, going to the gym, working out. I noticed that I couldn't even have strength to lift weights. So I didn't know what was happening to me, but I took it like a normal thing because I used to eat the way I used to. I came to realize it was a spleen that was enlarging. It was becoming painful. It was like a stitch. Yeah, because in a span of like 6 months, I'd lost around 30 kilos. So I decided to go for a medical check in a public hospital. The doctor asked me how I was feeling, and I told him, by then I was not in a stable state working. So he told me that was ulcers. Yeah, he prescribed for me the ulcers and antibiotics and painkillers. So I took them. Nothing changed. So I decided to get an opinion from another doctor somewhere else. So the test we did, he noticed there was imbalances in my blood. The red blood cells were way above 208. The white blood cells were very low. The blood hemoglobin was around 8 by then, and yeah, he suspected leukemia. So I had to get the test for leukemia back then in 2012, around that time.
All right. And that was before then you got your then actual diagnosis that you have,
Yes.
you have leukemia.
Yes.
And Dr. Dan, listening to what Otanga is saying, some of these symptoms mimic,
Other
like other
diseases,
other
yes.
diseases that it makes it a bit difficult because it says the first diagnosis you got was
Ulcers.
you have ulcers, right? But are the symptoms as noticeable? And at what point do you start, noticing the symptoms?
How do we get the symptoms? As I told you, it affects blood and blood-producing systems in the body. So initially, most of these cells come from the bone marrow. But now, when you start having proliferation of abnormal cells, we call them blasts, in your bone marrow, they fill up the areas in the bone marrow which is supposed to produce the normal cells. So the area that is supposed to produce red blood cells is filled up. It's like the industry has been used, the raw materials in there are being used to produce abnormal cells. Remember, they are white blood cells, but they are abnormal in that they are not able to fight infection in the body as it's supposed to be. So as they fill up these areas in the bone marrow that is supposed to produce red blood cells, platelets, then you now start getting symptoms because now your normal red blood cells will go down. He has mentioned about fatigue. If you're not supplying oxygen to your vital organs, the brain, the heart, then you start feeling fatigue. So that's when now the fatigue comes in. Look at the spleen. Spleen is very important in that it traps the abnormal cells. It traps the abnormal cells, the red blood cells, the white blood cells, and even the platelets. So the spleen will start to enlarge because it's trapping a lot of these proliferating cells that are being formed because they're abnormal. So because it goes through there for maturation to happen, once they reach the spleen, they are trapped. And that's when now he starts getting what we call splenomegaly. Splenomegaly is enlargement of the spleen. And then they start getting now easy bruising and bleeding. Even as a simple thing as brushing your teeth may present with bleeding of the gums. Sometimes they get nose bleeding. We call it epistaxis in medicine. So you're just sleeping and then you wake up, you are nose bleeding. Because the platelets that we say they are very important in prevention of bleeding, they have been used up or they are not being produced as it's supposed to be. Then there is another symptom that usually brings the patient to the hospital, the pain. The pain is as a result of infiltration of the bone by these cells. They cause pressure to the bones and they start having funny pains, especially at night. They cannot sleep. They cannot explain. There is no trauma, but they are having pains. They have not maybe even worked out or done an extraneous exercise, but they are having terrible pains.
All right. So then, Otanga, so after 2 months is when you got your diagnosis, right? And the doctor comes and tells you this is leukemia. What is the first thought that goes into your mind?
Yeah, it's not easy. It was not easy. Yeah. It was not easy. But you see, losing weight and not knowing what you are suffering from, the first thing is the treatment. And because it's a strange thing to me and to the family, you just wonder what is it, how to go about it, because a lot of things ring in your mind.
All right. And of course, we need to take a break. When we come back, we'd want to understand, so at what stage, was it? And of course, the whole aspect of staging for leukemia. And then something else, and that is leukemia in children. Because we see this as one of the most commonest types of cancers amongst children, and the whole treatment process for you, Otanga. So you do not want to miss that part of the conversation. Stay with us. This is Health Diary. We'll see you very shortly. Welcome back. Glad you're still with us. The show is Health Diary, and today we are unpacking leukemia. Like I said earlier on, one of the types of cancers that is rarely talked about, but is equally important for all of us to have information as far as leukemia is concerned. And of course, to help us with the conversation, we have Dr. Daniel Butorire, who is a medical officer, clinical oncology department, Texas Cancer Center, as well as John Otanga, who's here again to share his journey with leukemia. So, Dr. Daniel, can we also just get to understand the progression of the scene?
Different from what we call the solid tumors. You see, cancers, we classify them into two. Yeah. There are what we call the solid tumors, and then there are what we call hematologic malignancies, where leukemia falls under. Okay. So for solid tumors are affecting organs, for example, cancer of the breast, head and neck, and other solid tumors that present as a growth. Mm-hmm. So those ones, usually we can stage them from where they originated and how far they have spread. So we classify them based on the appearance, hematologic appearance and clinical presentation. Like now, the clinical presentation, the one that is presenting in sudden onset, we call them acute. The one that has a slow onset, we call it chronic. And then now we look at the morphology of the cells and say, this one, let's give it a number. We call it FAB system of classification. It's an M0, is it an M1, is it an M2? If we go into the classification, we may not...
too scientific. Yes. we might get lost at some point because of all the same. And there's something else that you mentioned very quickly, that is acute on chronic.
Yes.
So then what exactly happens?
Acute on chronic is a terminology that we normally use, especially for patients who have chronic leukemia, like now the CML that John has. It is a chronic myeloid leukemia, but it means the onset of symptoms and progression of disease, it takes time for it to be known, even the symptoms, for it to be now symptomatic. But if you're having a crisis, we call it an accelerated crisis, where patient is having symptoms and is deteriorating rapidly, it means this patient needs to start treatment. So we call it an acute on chronic leukemia.
Okay.
So that's basically what it means.
All right. Okay. And of course, so then you had to be put on treatment immediately after the diagnosis?
You need to go, not immediately. You have to go to do a lot of tests. You need to, the bone marrow has to be tested, the blood has to be tested. Yeah, and the results take very long, a bit longer. You can take even more than a month. Yeah. So after that, then you get the treatment.
The treatment. All right. And I know for you, of course, you're supposed to go for transplant. Yes. Stem cell transplant, right?
Yes.
Okay. But before that, then the management, because again, like we said, it's been 10 years, right?
Yeah.
So what exactly has been happening for you just to help you to manage the same?
Yeah, I've been seeing a hematologist. Now, through that, I've been getting the medication, but the response was very good. But it came a time when I think the body just stopped manufacturing its own blood, according to the test. So I was depending on transfusion. Yeah, of which transfusion is not a good thing to anyone. The side effects and the reactions.
That's true.
Yeah.
That's true.
Yeah.
So then, what sort of reaction did you experience, especially from transfusion? Because again, not so many people would know that once you transfuse blood, though there might be a reaction from the other end.
The last time I was getting a transfusion, my blood level was very low. It was as low as 6.6 hemoglobin level. So I needed a lot of blood. I got transfusion of 10 pints. 10 pints, that's getting blood from 10 people. Yes. And then all the blood is coming to one person. So the reaction, you get a lot of fever.
For blood, we normally say we need a HB level of above 10. Like for him, he says the HB was 6.6. So we normally say 1 unit of blood, we can add you 1 gram per deciliter of hemoglobin. And then for the platelets, we normally say a minimum of 50,000 red blood cells per deciliter of blood. You need at least that. So you may transfuse, and we target 100 for a patient to be able to qualify to start treatment. But we still just give treatment and transfuse platelets. The only known treatment that cures, especially the chronic leukemias, is bone marrow transplant. So
then when we talk about then bone marrow transplant, right, for someone to really understand like what exactly happens.
Yes.
Because you see, like for like a kidney transplant, one person gives organ, you and then you transfer. But what exactly happens?
So in bone marrow transplant, majorly I would say it's categorized into 3 categories. You can get bone marrow transplant, whereby it's just a needle. They go in, they sieve out your bone marrow, then they store it somewhere. Then you are given chemo to wipe out all the bone marrow that you have. And then after we have wiped them out, we infuse into your bone marrow with new, what we call stem cells. So where can you get the stem cells? You can get it from a close relative, first degree relative. These are relatives whom you share either a mother or a father. Because if it's someone from a distant relation, your body will reject this transplant.
Okay, all right. And how then has that impacted your day-to-day life? Right? Because someone might look at you and think, this person is okay, looks healthy, he's all fine. But just paint that picture for us, especially when it gets bad. What does that look like?
My body has undergone a lot, but when it comes to fever, that's too much. Because the pain, you can live with the pain, but the fever, you have to stay in a blanket, in bed. Yeah.
You can't sleep.
You can't sleep. You can't do anything.
Appetite is low.
Appetite is lost. But for the pain, you can manage some small things. Even though the pain is not that good.
But Dr. when you talk about then the treatments and prognosis, what does that look like after the transplant?
They say for adults after transplant, the cure rate is above 50% for adults. For children after transplant, the cure rate is over 99%.
And then so after treatment, that is after the transplant, are there like after care that maybe a patient needs to
Exactly,
know?
exactly. After transplant, the same treatment we normally give for patients who go for organ transplant is the same. We need to suppress the immunity of this person so that the body can try and not to reject the transplant.
So then, Otanga, for you, take us through them, and especially the management, like over time, as you've been able to do. Of course, there's the cost aspect of the thing, right? So then, is this covered? Were you paying cash? Like, what has been the cost aspect for you?
Yeah, the cost aspect has been we've been paying cash. Yeah, get support from my family members, myself, some income. Yeah, and later on I got some cover, but much later. You see, for consultation, to see a consultant is not that like the one you go with the hospital to get no. Yeah, there's a specialist, so we appreciate them. So you have to pay for the consultation fees. Yeah, and for now, as we are going for the transplant,
Bone
marrow transplant, we try to raise some fund. My family and friends have come in, and some from the cover that I got. Yeah.
All right. And to what extent then does insurance maybe cover for this, if it covers at all? To what level?
It depends with your cover. You may find sometimes you have already exhausted the insurance even before you go for transplant. But the good thing is that if you're getting treatment outside the country that is not available inside the country, and it can be justified by at least 2 consultants that it is essential and is beneficial to you, I'm very sure the NHIF also covers a bit of that. I don't know in your case.
It's covering.
Good. Okay. But then what will it take for us to have this form of treatment in the country so that people don't have to go outside? Yeah.
It is all about the goodwill. We depend on the goodwill of the government to bring these resources here, and also training of the doctors so that we are able to offer such treatment in the country. And as you understand, the facilities are also very important.
Yeah. So then pushing for like early detection and screening, can people go for screening? If so, where, at what point, how often?
Leukemia actually is among the leading cancers in this country. It is ranked number 7. There's no really screening guidelines about leukemias, the hematologic malignancies. As I've told you, it's ranking number 7. So the priority is given to.
It's usually for the
first 3.
Yeah, first 3. Yes. All right. And Otanga, for you again, what would be your call to action? Because again, having gone through this journey for over 10 years, but finally you're going for treatment, which is a really, really good thing. And we really, like I said earlier on, we're really, really praying for you. But what would be then your call to action, either to the government, to the, healthcare facilities, to people, who are watching us, as far as leukemia is concerned? Right.
All this time I've been praying for something to come up for the treatment, because as a patient, you pray for the best, because you pray for the government to have maybe constructed somewhere. We have cancer centers, and the facilities I don't know how expensive it could be, but I think the government can do something on that.
So that again we don't have to go outside and seek for treatment. We can get this treatment here in the country. Thank you so much.
You're welcome.
Thank you so much. And we really pray that everything goes well, that we see you very soon, back on your feet, healthy, and of course, going back to work. Joe Notanga, patient living with leukemia, of course, giving us his experience as far as leukemia is concerned, together with Dr. Daniel Butorire, Medical Officer, Clinical Oncology Department at the Texas Cancer Center. We say thank you to both of you for coming by today. And of course, time now for you to take a look at this health tip.
Braces are used to correct teeth that are not properly aligned, and as a patient there are tips on how you should take care of your braces. Number one, braces are foreign objects in your mouth, and therefore they can easily trap dirt more than what would happen in a person without braces. So what that means is then that you should brush after every meal. Secondly, there are foods that you're not supposed to take and when you have braces. This include hard food, because during braces, teeth are being moved and therefore they are weak. You are also not supposed to take sugary and sticky food, because this again will affect your teeth, such as gum disease. If you don't clean properly, your gums will start becoming swollen, and also you can develop dental cavities.
Well, thank you very much for watching until the end of the conversation on leukemia right here on Health Diary. I'm pretty sure that you've learned a lot from today's conversation. We want to say special thanks to 4 Points by Sheraton for hosting us. My name is Winnie Lubembe. If you have more questions on the same, feel free to engage with us on our social media platforms. Until next time, adios. Now, cancer. You sound cancer again. Good.